Addiction is a chronic, relapsing condition with four types of addictive disorders: substance abuse, substance dependence, chemical dependence, and behavioral disorders. Addictive disorders are caused by multiple factors, including genetic vulnerability, environmental stressors, social pressures, individual personality characteristics, and psychiatric problems. It is a disease reaching epidemic proportions. Addiction differs in prevalence and severity in different parts of the world. In 2007, 93% of the world's opium supply came from Afghanistan. The so-called Balkan route continues to be the most important for heroin trafficking. The number of people between the ages of 15 and 64 who used illicit drugs around the world in 2013 amounted to a whopping 246 million. Over 29 million people who use drugs are estimated to suffer from drug use disorders. 12 million of those people inject drugs. Reports by the UNDCP have shown that there has been a global increase in the production, transportation, and consumption of opioids, mainly heroin. Heroin use has become increasingly common in North America and Europe since the 1960s. The worldwide production of heroin has more than doubled since 1985. The use of heroin in particular is causing a widespread health and social problems in many countries. There is a huge surge in the heroin market, which an increase in availability and use of heroin in some markets in Europe, as well as a major increase in the size of individual seizure cases of heroin. In Europe, heroin injectors who regularly consume large amounts of different drugs face a risk of death which may be 20 to 30 times higher than non-drug users in the same age range. Since heroin is commonly used by injecting, the health risks include that of HIV and hepatitis transmissions. 1.6 million people who inject drugs are living with HIV, 6.1 million are living with hepatitis C, and 1.3 million are living with both hepatitis C and HIV. There is a strong correlation between life-threatening diseases and injection drug use.
The United Nations have come together to tackle this global crisis. The organization has been gathering drug use data on the international scale since 1998. When the numbers showed spikes in opioid use at the global level, they came together to create policies that would help nations combat drug addiction. The resolution titled Our Joint Commitment to Effectively Addressing and Countering the World Drug Problem is their people-first approach to solving the problem.
The main method of deterring addiction and trafficking is through criminalization, but this does not necessarily work and has recently been deemed as a flawed method as more and more countries, such as Portugal, turn to decriminalization. A policy currently being supported by the UN and the World Health Organization, where the aim is to reduce consumption through education, information, and prevention programs. If you or someone you know suffers from addiction, there is hope. You can call 1-800-662-4357, a national helpline that supports more than 65,000 people per month.